the type of appointment. One difference from Success to Intergy is this first column. In Success today on your console, you have both the appointment view and then you have a My Next Patient that allows you to see where the patients are currently located. In Intergy, those two views are combined into one. So this first column is allowing me to see where that patient's currently located, or if I needed to change them to a different area, like the nurse rooming the patient, this is where she would go to do so, just by clicking into that area. But as you put your cursor over the top, you are able to see, how long the patient's been in their current area. On the right-hand side window, this is where you're able to see the different tasks that are assigned to this doctor that they need to be following up on. These would be like that left-hand column on your clinical console today, where your tasks are listed, things like your flags or your phone medical messages that need to be returned or orders that need to be signed off on. That's what you're seeing in this right window. Now, there are different ways to view this information. You may say, well, I don't like to see that busyness. Well, I can just uncheck the show detail and then I'm not seeing all the detail, but I can open up any of the windows to drill down into the information. Now, the different task items or the categories that I'm seeing there are only the ones that I have outstanding items for. If I don't have anything, like in the transcription, then it's not even going to be on my window. So it's not going to be there unless there's an open item. You do have the ability to change the view. So maybe I want to open it up and be able to see, which patients, and that might be a way that nurses like to look at it. If I'm following up on the orders that the doctor's placing that he wants me to go in and draw the blood for, things like that, on my view, I may be looking and following it, listed out by the patient name. But you do have different ways that you can bring those list ups depending on your own individual preference. Bottom right would be your encounters to sign off, or open notes is the way it's called in Intergy, that still need to be finished up and signed off on. Now, the different task boxes that you see going down the left-hand side, or the different icons, allow me to further drill into each of those individual areas. So if I wanted to, for instance, open up my orders management section, this is where I would go in to follow up on different tasks that I have open. And I can go through and say, well, just show me a certain type of task, and then it would narrow it down to just that subcategory. So just depending on what I'm looking for, I can say, just show me my outstanding referrals. And then I also could say, show me only the ones that have been ordered, or I'm only looking for the ones that have been resulted that maybe I need to sign off on, or the requested ones. So I can narrow down that list to just a particular subset. And then also notice that I can see the due date. So if something is past due, I'm also going to have that brought to my attention. I also have the ability to say I only want to see the ones that have been sent to a certain user, or the priority status. Was it low, medium, high? When that task was created, I can sort it by those 1, 2, 3 priority as well. So besides order management, you have other things like maybe I just want to open up and see just my appointments on the view that I typically work off. This also allows me to see any comments that my scheduling may have added at the time that the appointment was made, so I can see that information. If I were ready to get started with a patient, I can just click on a patient's name, and now the system has opened up this patient's face sheet inside of their chart. The face sheet is customizable so that you do have the ability to decide which sections you want to see in your personal view. Also, you can change the order. If I wanted medications on the left, problems on the right, things like that, you can make changes to the view that you're looking at. You also have the ability to work from this view. So if I said, I need to add a diagnosis for this patient, or I want to go in and add a reported med that they've told me another doctor started them on, or maybe I want to reconcile their meds from here, or if I wanted to view lab results. Also, noticing the red exclamation mark, that allows me to know that there is an abnormal finding associated with that lab, Or if there's something that's been marked high priority, that would also be indicated with a red explanation mark next to it. So you do have the ability to go in and see. Someone had a question about, we will not be looking at the dental software today. If you specifically want to see the dental, we can set up a separate demonstration for someone to show you that, but we will not be talking about the dental software today. Okay, so face sheet, you can make your changes. On the right-hand side of the screen is where I would be able to see information that might be important to today's visit, like, why are they coming in? And in this case, I see the patients coming in for 2 separate visits, so that you are able to see separate visits. If the patient's coming in for more than one visit on the same day. I know many of you may have the patient coming in for the doctor and then 2 hours later with the dentist or maybe behavioral health. So I would be able to see different types of appointments there. If vitals had been entered, I would be able to see the vitals that had been entered in maybe prior. Or if I were wanting to add new vitals, I would just click Add New, and this is where I could go in to actually key the vitals in, or to retrieve them from equipment if I have equipment that's set up to automatically download the vitals, such as like Midmark or things like that have that type of equipment. You're also able to see health reminders that are due today. Now, those are coming from some national standard guidelines that are preloaded into the system. Big difference here between Success and Intergy. In Success, you would have gone into the clinical event manager to create your alerts. In Intergy, it comes preloaded with a large library of guidelines that are already pre-built. Now, you do have the ability to go in and customize those, tweak them a little bit to make them your own. Maybe one of them is saying this is a reminder is something that's typically due every year, but you say, no, we do that every 6 months. You could go in and tweak that to make it your own. You also have the ability to totally create a new guideline if there's something that you're looking for there that's not actually already included, so you can use those. If I needed to go in and specifically review the details of the reminders that that patient has, I am able to see the different guidelines, and I can see what the guideline is based on. So this one's based on males between a certain age range. This one's looking more at a disease category. And some of them may be things that are more for following up on measures. So that I'm checking off a UDS measure, or I'm checking off a CQM measure. So different measures. If I had satisfied one today, if it's something like it's looking for a lipid profile and I ordered it, it's automatically going to take it off my list. But if it was something maybe that the patient reported that they had done something else, like colonoscopy screening, then I might want to come down and indicate that it was previously satisfied somewhere else and put in the date. Or if the patient says, I'm never going to have that done, I can go in and mark it refused or contraindicated. And then I have the ability to say, remind me again the next time that it's due, or don't ever remind me again because the patient says they're never going to have this done. So you do have the ability to go in and make changes to that. You also have the ability to go in and say, not only do I want to see the ones that are due, but if I were wanting to see the last time that I have met certain measures, I can also uncheck the due only, and then I would have a history of the last time I had met other measures as well. So you do have some flexibility in what the view looks like depending on the way that you want to use it. You also can have immunizations that are broken out into a separate category, or you could have had immunizations in your health reminders. If I'm a pediatrician, I'm probably going to have my immunizations broken out separately for sure, but those are based on what you want to do. Now, a couple of things just on the guidelines. You can, let's say that there were, 500 different guidelines in there. You do have the ability to say, but out of that 500, there's only 50 that I want to use for my practice. The rest of them are just not things that are important to me. You can create your own subset of the ones that you want to have the system automatically populating for you. So you do have the ability to see that. All right, so if I were ready, or let me explain the left-hand side real quick to you. These different icons here, this would be similar to the tabs that you have on the right-hand side of your chart in Success Today, where you have like problems and orders and vitals. Same type of concept here, where I can just go in and quickly just scan maybe some of, labs that have come in or immunizations that are due. So I can just do a quick scan without opening that up, or I could click on any item and actually drill further into it. Also, from moving around the system, if I were ready to go to a different patient, I could go back to that appointment screen where we started, but I also have this scroll bar here at the top that also allows me to see all the patients that are currently in the clinic. And then if I needed to switch to a different patient, I could just select that patient's name from the top of the screen, and then it's going to switch over to that patient for me. So just another way that you can move around the system if you choose to. You do also have the ability, I know a lot of people ask about being able to see different types of visits, like your billable or your non-billable visits. And by clicking in this section, this is where you would go in to create a new encounter, and you can mark it billable or non-billable as necessary. So just different ways, moving around the system. If you wanted to scroll using the scroll bar, just another shortcut for your doctors, or if you want to go back to the appointment screen, you can do that as well. So very easy to switch back and forth between the different patients that are in the clinic today, if you want to use that option. That's not something you need to use unless you just choose to. So let's get started by looking at the noting process for this particular patient. Again, depending on the way that you want to document or whether it's a billable encounter, you could go in and start by pulling up a particular type of visit that you already have. By default, the system will automatically just open up the type of visit based on the appointment. So it's, if they're scheduled today, then it's just going to open up the appointment and tie it to the encounter. But if I wanted to change to a previous visit or to a non-billable, I have the option to do so. When I go into the noting process, Intergy is based on medicine, the same that Success EHS was. So the core, structured clinical knowledge base is going to be the same as what you're accustomed to working inside of Success EHS. Now, there are a couple of different ways that you can go about using medicine in Intergy. That's going to be a little different than what you see now. But you do have a couple of different options. So first, I'm going to show you a view that is very similar to the way that you document your progress notes today. And then I'm going to show you another way that uses medicine that's slightly different and has a different look and feel. So the first thing I've done is opened up, and if I wanted then to decide what form I was going to use, I can have my favorites list. Like in Success, you have your 10 that come in the drop down that you can either pin or see the most recent ones that you've used. Same concept here in this Mine folder where I can see my common ones that I use. There is not a limit of 10. If I had 15, 20, 30 that I wanted to have on that list, I could have that list. Intergy also has a very robust library of templates that have already been designed by other users or by Greenway of different types of templates that you can start with. Now, one thing to take note of, your existing medicine templates will not be able to be converted from Success. Because they're in a different formatting structure, it is not something that we can map across for you. So your existing templates would have to either be recreated or start by using some of the ones that are inside of Intergy and then tweaking those to make them your own. Now I'm going to go ahead and open up a template, and this is just sort of a generic, primary care type template, allowing me to see different things that I might want to log into. If there were particular areas that I wanted to go ahead and address, like maybe I've got a couple of the meaningful use questions that I wanted to go ahead and check something off for. So I could go ahead and indicate that there's a question there that I wanted to go ahead and answer. On the CQMs, maybe I want to go ahead and indicate that there is no fall risk or low fall risk, and I want to check that off my list. Tobacco use, maybe I want to indicate that we did some counseling with the patient in reference to that. So I can build my CQMs and meaningful use questions directly into, tabs right directly off of the typical templates that I may use. If I were ready to go in and document, I could choose the template, and this is going to be very similar to what you're accustomed to seeing in Success, where you can check mark your options here. One difference is when I check one of the boxes here, if there are drill down additional questions in Intergy, in medicine, then it's going to go ahead and open up those questions for me. So instead of having to use the little arrow, I'm sure some of you, the drop down arrow to open it up if there's something you want to add, those options are already open for you. If there were certain tests that you performed that you wanted to mark off, you also have the ability to check off different tests that you're either performing outside or ordering depending on the way that you set it up. You also could go ahead, if there's something you had done inside the office and you wanted to go ahead and mark positive or negative findings for that, you can do that as well. I do have the ability to go ahead and select a diagnosis from here, and I can get specific by selecting an option here on the right-hand side. So you do have options there as well. Another common question that I've had from Success users for years is if I want to include a drawing inside of my progress note, I've never had the ability to do that. So let's say I had just done a foot exam on this patient and I wanted to indicate that there's something here on the foot, and maybe I even actually want to put a note in as to what that is. I could go in and mark that, and then that becomes part of my progress note today. Now there's a whole library of different illustrations that are available to you that come standard with the system. So if there was something particular that you're looking for, like in podiatry, I may have certain types of images, or for full body skeleton, but you'll see there's different sections for all of the different areas of the body. So if there are illustrations there, you can always utilize those. Or if there's not one, you could create your own and add that just in the general section in there. You also have the ability, though, to bring in an image or a picture. Maybe you took a picture of an injury or a scar or something like that that you wanted to incorporate into your note. You have the ability to do so. Now this is just a logo I have out there, but I could go in and say I have an image that I want to bring into my note. I could bring that in, and then I could actually draw on that image as well. So drawing is something that is new, to something that we did not have before. Another thing that I've had questions asked about for many years is the ability, I'm in the middle of documenting my medicine note, and I need to go over and look at something else in the chart. Intergy gives you the ability to split the screen. So I can still have my medicine note open, and maybe the patient's discussing something about a previous progress note, and I want to go back and read that while I have my note open. Well, I would have the ability to do so by opening that up. Or maybe I'm thinking I really need to look at their flow sheet values at the same time that I'm documenting. So I could be over here documenting in a form, checking things off, but maybe based on some of the values, I want to check something different. I have the ability to do so. So you can split the screen and be able to see two different things at the same time. And then once you're done, you can go back and join and go back to your note again. But you can split it so that you have the ability to see those two sections as needed. You also, for any of you that use medicine lists today, where you maybe have some pre-filled information, like I could say, bring in my normal review of systems, and if I went and looked at the preview of this note now, my normal review of systems has now automatically come in. I know many of you may use actual complete notes that you bring in with physical exam elements and things like that. So any of your different lists that you use in Success today, you would build here in the favorites and be able to go and pull those. And the same concept, you can have both shared where everybody is using a common library, and at the same time have my own favorites that I bring in to my own short list. The other thing as well would be being able to bring in from a previous encounter, so you have the ability to do that as well. And you also have the ability to have your family history for pediatric patients. If this patient were pediatric and there were multiple siblings, then I do have the ability to import patient in from one child to another. So you do have some different options there. So a lot of similarity in the way that you can document in using medicine today versus the way you're doing it in Success, but also with the flexibility to use some of those new capabilities as well. Now we have a few questions, so I'm going to stop and see if I can answer a few of these for you as well. And then we'll move on to the second view. Let's see. Will you be able to see the task list for providers as we are? Yes, you can change to different providers. I can change from one view to the other, like you go to the provider list down there and you can change. I can change from provider to provider depending on the ones that I have rights to. Okay, another question. Can you see primary and secondary? I think just the primary shows up at the top of the screen, but you do have the ability to look at the info button here, and this would allow you to see more additional information on the patient, including if they had multiple insurances. So not directly from that tab bar at the top of the screen, but you can see it by clicking on the blue info button. So you do have an option to open that up. You can customize the healthcare guidelines to the individual practice. And clinical history would be like, yes, past medical history, family social history. That's where you can go through and look at the different aspects of the past medical history. Okay, can you customize it where you can only see one chart? I'm going to double check for you there. I do believe that you have the ability to go in and turn off that purple bar. I believe this is what you're referring to, so that you do not see the option to jump back and forth between the different patients. The thing to keep in mind is even though I have the option to switch to them, only one chart is actually open at a time. Is there a way to upload CPT codes? Okay, yes, CPT codes are attached directly to the quality gaps. So like inside of when I was going through and doing the documentation on this patient, and I documented that fall risk, it automatically attached the code directly to that particular quality measure, as well as for other things that like I were placing orders for, I also can see like the CPT codes that are attached to them. Okay, and there's a question as far as the ability to, the creation of the documents. You know, it is similar to what we have in Success today, but I do find that it is easier for me. I've been building medicine templates and Success for many years. I find it easier to work with. And maybe that's something, if someone has specific questions, we can set up a separate demo to actually open that builder up for you and let you see more detail there. And let's see, chief complaint. I'm going to show you chief complaint. I should have shown you that when I opened the note, but I'll show you that on the next version that I'm fixing to do. We do have some templates for infectious disease and HIV. We do have some that have been created. I'm not sure how robust that library is, but I can certainly find out for you. And also, one thing to point out, there is a library capability out there, sort of like a forum where people are invited to share templates and to talk to other Intergy users. And many times, other groups are more than happy to share templates with you. And that's as simple as doing an export and then them just emailing them, and then you import them into your system. So if we do not have specific ones, we can certainly go and look for that. One last question here, and then we'll go back. Okay, does the doctor have the ability to review the charges at the end of the day? Let me come back to that when we get into reviewing charges. So we'll get to that in the next session, and we'll talk more about that. So I think I understand where you're going with that, but you can go through and add modifiers. And what I've actually opened up right now, the screen that you're looking at, is like what Intergy would be replacing the eSuperbill with. So this is like your charge ticket. So this is where your eSuperbill would come into place. A couple of things though. This first tab that I've opened up to is something called Predictive Orders Management, and it's going to serve several functions for us here. One is to, let's say I'm going to give this patient a diagnosis of hypertension. And I could go and search for that based on the code if I knew the code I was looking for, or I could have typed in a description. So I could go in, and now I've added that diagnosis for today's visit. Now, I particularly chose hypertension because I know that's one that I've played with a good bit in my system. And the system has learned based on the way that I have treated patients with hypertension. So me as an individual provider, as if I was logging in as a doctor, it's saying, well, Susie, 80% of the time you use lisinopril when you're treating hypertension. 60% of the time you may use microzide. You also typically order a CBC and a lipid, so it's learning based on the way that I normally treat certain problems. So if I were a podiatrist and I was seeing my 10th, plantar fasciitis after I'd been on the system, it's going to start saying, well, you normally do a steroid injection, or you normally give them this certain medication, you normally order a boot. So it's going to learn from what you normally do. So it's just another option of how the system can use machine learning to make steps easier and eliminate different steps for you. So if I wanted to order, from maybe the things I typically do, I can do that directly from this window. So I don't have to go to a pick list or change between these eSuperbill views to place the orders of the things that I normally do for that particular diagnosis. Also, up in this top window, it's saying these are the things that you ordered as part of your progress note. And if I just say select all, it adds those orders to my charge ticket for today as well. Another thing that I wanted to point out also is over here on the right-hand side. Based on the clinical guideline reminders that this patient had, there are some different things that had orders tied to them. So if I said, oh yeah, let's go ahead and get that hemoglobin and his PSA done today, based on the guidelines, it's telling me here are some additional orders that I might want to place. So you do have several things that can help you with quickly placing orders without going to like a pick list view to go in and order. But this is where, if I needed to, I could switch over to, like you're used to your pick list, and Intergy, they're called your favorites. But this is where I could go in and say, well, also I need to send him for a referral, so I could go ahead and place that referral. Now also down here on the diagnosis, it's telling me that the diagnosis that I selected as part of my template, I didn't really pick a ICD-10 specific, so it's telling me and allowing me to go in and get more specific with that. Now if I were finished with this patient, then I could say, okay, I'm done with him. Or if I needed to go in, I didn't select an E&M code, so let's go put an E&M code on here. Let's say we did a 99212. You also can go in and add modifiers. Someone had a question about modifiers. So if I said, well, I really need to add a 25 modifier on here, and I really want to relate this to the hypertension as well. So this is for your mapping of your ICDs to your individual CPTs, or adding modifiers. That's just an option of where you can go in and set up some additional things there. But if I were done with the document, then I would save it, and that's sort of like submitting your super bill. So if I were done with that, I would submit the ticket, and then the system's going to do several things. One, I've got it set up to where it's going to do my drug-drug interaction checking for me. So that's just going to be part of my save routine. Now I have two options here. I can say I want to just go ahead and quick accept, which means I'm not going to put any comments or add anything. I just want to accept it. Or maybe I think, well, I really need to add a reason as to why I'm going to accept it, since it's giving me some recommendations. Now this little window that I've just gone into is something you're going to see throughout Intergy when you're going into different types of reply boxes or text boxes. It's going to give you the option to already have pre-built in the macros of things that you typically say in that particular area. So instead of having to type that line in, I just pick it and it adds it in, and now adds that as my reply there. Now as part of saving, I also have it tied to where it automatically sent my prescriptions at the time I hit save. So now, instead of me having to go into medications and click on the ERX button to go in and send electronically, it's automatically sent my prescriptions for me. So again, just another keystroke that we're trying to save for you there. Also, part of my orders was a referral. So I wanted to show you this so that you could see that every order you place is going to allow you in the background to say this type of order typically goes to who. So in this case with referrals, maybe who is not a particular person, but it's a group of users. I want to assign this to my front office pool. So instead of sending it just to Susie, I'm sending it to Susie, Mary, and John, because we all share in following up on that type of responsibility. So you can have the system automatically define different types of tasks to different users. The preview here, as part of setting up a referral, if I had already tied in one of my correspondence documents to the referral of the type of letter or document that I typically send, I could have that tied, and then whoever's going to follow up could actually open that up and make any needed changes to it. Now, talking about patient correspondence, let me show you a couple of other things while we're in here. You know, it's not just for referrals that I can send that, because I'm sure many of you do use these for like your return to school slips or your school physicals, different types of things that you're, you know, have a standard form that you want to be able to print out and provide to the patient. So you can create your own formats and have those built in just like you do into your patient correspondence today. So you can bring that information in. But just wanted to show you that's an example of using the patient correspondence capability in the system. Now at this point I want to jump over. I mentioned that there's a different way that you can go about documenting with medicine. So I do want to jump over and show you what that other view looks like. So I'm going to go in and open up a different note here for you. And this is something that Intergy refers to as visit note. And I tell you what, instead of starting with a, I'm going to start off with a, oh, this one's already signed off. One sec. Let me start you off with a new one. I want to start you from scratch because someone had asked about seeing the chief complaint. So I just want to show you what it would look like from the beginning. Okay, so you do have a chief complaint window like this. So this is where I would type it in, why is the patient here today? So if I wanted to go in and actually type in that notation, I could do so. So I could say they're here with a headache. I could also review lab results. If I had entered, I just created a new visit, but if I had the lab result, the vitals from today's visit, those would be displayed here as well. Then on the right-hand side, these are different templates that I can open up. Again, same type concept that I can have my personal folder or the ones I prefer, and I also can have my shared folder. And then I could select the template that I wanted to use to start my documentation. And I guess since I said headache, I should have picked one, but we'll just pretend I said low back pain. But I opened up a template, and this already has some information that is pre-filled already. So for those of you that are accustomed using like pre-filled list, you notice that my review of systems, before I click on anything, is already part of my note today. My reason for visit, I went ahead and put a reason for visit in there. You see that I also have some information that I've told the system that I want to have auto-cited into the note. So this is allowing me to see, the social history, the past medical that's come in by default. On the left-hand side, I've also told it I want to see my active problem list and my current medications, my allergies. Those are all options for what is cited in that each provider can decide what makes sense for them. But this look and feel is a little more similar to like the medicine list that I would say go ahead and have the standard things that I would typically answer for, that I want to talk about the timing of the pain when I'm dealing with this. I can always add notes. So if I wanted to go and add notes, I can add notes to any of the sections. In the review of systems, the ones that you see in the standard fonts are things that were already pre-filled information. If I needed to change any of that information, I could go in and change just by changing similar, positive, negative, that type of thing. Or if I wanted to document on one of the sections that are in more the italic type font, I can open them up and go in and say, well, actually they had some vertigo and some dizziness that I need to make note of there. Then I could go in maybe to my physical findings and go in and document whatever I needed to in that section. So just a different way of documenting and adding notes. A couple of things though, there's some flexibility in this view that you don't have in the classic view of medicine like you have. So let's say I don't like the way that medicine output reads on toe walking. I don't want it to just say abnormal. I would say, I don't know, outside normal expectation, something. So if I wanted to change the medicine output for a particular finding within this particular template, I would have the ability to make that change and then save that as my new template. And then every time I made that selection, it would use the new output of how it reads in my note. Now that does not change the finding that you selected. So for your people that are thinking, oh my gosh, for reporting, don't let them mess up my report. It's not going to change your report because the medicine finding is still the medicine finding. We're just changing the verbiage that shows up in the note itself. So that is something you can do here. You also have the ability to change like headers. I could say, I want it to say exam instead of physical findings. And on this one, I don't want it to be there at all. I want to delete that whole section. So I can quickly go in and make changes to any of the different areas. I also could be working off of multiple forms at the same time. So if I wanted to choose a different form to have multiple forms, merged into one, you have the ability to do so. You also can set up your order sets. For those of you that use order sets, I can create them here, or I also can create them as favorites in the classic way as well. But for like on this patient, if I said, well, let's go ahead and get all of their normal, annual mail orders placed today, With that one click, I've placed all of these different orders like you would in an order set in Successes view today. Okay. You still have the same drawing functionality that you're accustomed to. You also can add free text anywhere that you choose. And when I say add free text, I could pick up a microphone and use Dragon if I had Dragon loaded on my local machine, or I could type that information in. So it just depends on what my preference is as how I enter in narrative type information. So you can have your own different forms that are in this different look and feel. So it's just going to be a matter of preference. One doctor may be using this look and feel. Another doctor may really prefer to stay with the classic. And then this is an example of the output of your note, what that potentially might look like. Because you can do some customization on the way that the output looks also. Okay, let's answer a couple more questions here and then we'll move on to looking at tasking. Okay, somebody was just asking about how do you review the entire note. So this is how I can look at the entire note to see what that's going to look like. And I can make changes from this view as well. So if I were looking at my final review of the document, I said, oh, actually they did say that they were feeling tired. So I might want to go in and make changes to that. So I can do things like that directly from this view. Also, if in the middle of this I said, well, I should have really added that, diabetic foot exam drawing directly into the note, I can do that from my review. So I can do things like that. Okay, someone's asking a question, Sue, about the diagnosis support synonyms. Not really. Now you could add an option to have a quick link to like a Google search or a Google website if your doctors prefer to use a Google. When you're searching for the diagnosis, you do have some options, but it's not like a Google search window if that's what you're looking for. Okay, it's asking, someone's asking about lab orders and the ability to tie those specifically to a patient's insurance. Not really. It's not going to be checking to see what their insurance allows, but if you know you have particular tests that are unique to something that the insurance normally would pay for or would not, you could set up your favorites list based on the insurance that you could then go over and review when placing that order. Okay, yeah, today's demo, someone's asking about talking more about specialty. We're really not, we're sort of just gearing this particular presentation to giving you the big picture of how the application works, but not really drilling specifically into, like I think you asked about general surgery. We really won't be looking specifically at that. But if there are things that you need to see, if you'll reach out to your account exec, they can set up a personal demo to show you some of that unique functionality as well. Okay. All right, couple of more things. I wanted to go back and show you something I failed to mention when we were on that last note was the ability to see that you can have different types of forms like PHQ-9s, audit, DAS, different types of screenings. You see that we have some that are already pre-built. Others, if there was something unique you needed to build, you could build a similar type format to have something like that built as well. So you do have some different options of having some different questionnaires built in. I want to go back now that we've documented a note and show you a couple of other things. Looking at the different tasking capabilities, let's look at how we would follow up on some of the different types of tasks. So let's say that I needed to review some lab results. I could open up that particular area and then I could go in and select the one that I wanted to go in and review. It's going to open up the information, allow me to see what the results look like, and if I'm good with it, I could just say quick review, and then it just signs it off reviewed at that point. Or if I wanted to review it and add a notation, I would click review. or maybe I need to send it over to someone else to take an action for. And you notice I have this quick text option available to me from here again. So this is where I could go in and have things that I typically tell my nurse about this type of thing. And I just choose it. And then when I forward it, it sends it over to my nurse. Now I do have the option to say, I'm going to send it to her, but I still want it on my list. By default, you probably want to take it off, but those, that's at your discretion as to what you want to do. As you're reviewing lab results, one other thing I wanted to point out, hang on, let me see if I can find one that has multiple labs on it. Okay, this particular patient, you notice there are multiple tasks that were done on that same day that were requisitioned together. Since they were requisitioned together, the system will allow me to review them as a group. I know that's a request I've had with Success clients for a long time as well, is that why do I have to review my LDL and then I have to review my A1C and I have to open up and sign each one individually. This does allow you to review all of the different tests that were done and requisitioned. That's the key thing together. They have to have been requisitioned together, and if they were, then I can sign them off. If I had a refill request that I needed to do, I could go in and review the request from here. And one thing, notice this little, the yellow box on the left is my info window. And I have mine opening up automatically as I'm going through and looking at text at different tasks. That's at my discretion whether I want to do it that way or not. But you do have the option of having it set up so that you can see, like maybe in deciding whether I'm going to refill this medication, I want to know when their last appointment was. When's their next appointment? Maybe that's information I usually like to see, or I want to know what their insurance information is. So you can set up information that you want to see and customize that and have it open by default or not. If I wanted to authorize that prescription with changes, I would say authorize, and then it opens up the window to allow me to make changes to it. So I could go in and make a change to it as necessary. Or if I wanted to quick authorize, that just means send it to the pharmacy. I don't need to change anything. Or maybe I'm going to deny it. Or maybe I need to forward it to my nurse to take an action like we did with the labs. Now, those requests for refills may have come from the pharmacy electronically. They may have come from the patient portal where the patient requested it. Or also it may be the patient called in and talked to someone in the office and they created that medication request. And I'll show you how that's done here in a few minutes as well. But you do have the ability to take the different actions depending on what you need to do from any of those areas. Now, a couple of things I do want to show you as well. I want to bring up a pediatric patient just to show you that for like your vitals, you do have the growth charts. So if I wanted to go in and see growth charts on a patient, I do have the ability to see full term, preterm, or downs, and also to go in and either see CDC or WHO formats. So if you have a preference there. You do have your immunization schedule. That's also allows you to come in and see what's currently due for the patient, and to also be able to see what the schedule looks like so that I could see that information. If I needed to switch to a different provider, someone had asked about what about I need to look at a different provider's view, and this would be like that provider view that you have the option from your clinical consult today. So now I could switch and see a different provider's view. And things like, specialty views like for looking at your OB patients. If I wanted to see what an OB structure looked like, I can see the prenatal flow sheet. So I'm just going to go in and open one of these up so I can see what the prenatal flow sheet would look like. If this was a return visit, this is where I would be entering that detailed information that shows up on your flow sheet. Initial visit and the information that you would normally capture. It's very much designed according to the ACOG, different structure that. any problems that they may have or risk factors that you need to be aware of, labs, ultrasound, education that you've done with the patient, and then just their health reminders can all be seen from that same view. As well as if I wanted to look at delivery information, this is where I can key in like, birth weights, location of birth, different type of data such as that. So you can go in and do that. And if it was a postpartum visit, there is a special tab just for the postpartum. And if I needed to print off a view of the prenatal flow sheet to provide to a patient, you do have the ability to do that as well. So you do have that in a very nice format that you could provide to the patient. And let's get back out of here. And let me go back to questions here. I see we have a few more questions. Screenings, yes, you do have the ability to do screenings. Dental Media Dent still works with Intergy, just like it did with Success, very similar type functionality. Or if you're using Dentrix, we do have an interface with Dentrix as well. Okay, if you have a doctor that does not want to use templates, they do have the ability to dictate their entire note. They would just open up a window, like a template window, but instead of having checkboxes, they would just have an area that they would click directly into, and they would start doing their dictation. They do have the ability, though, to go ahead and build markers, dictation markers into like subjective, objective, like if they're like doing like a SOAP note format. I can also go in and set something up like that. But yes, they do have the ability to use Dragon and dictate their entire note if they want to do that. Okay, I want to see if you had sent like a task to a nurse, so I'll come and show you that here in just one sec. Okay, what about your PMF screening alerts? Now, I'm not sure what you're referring to, Chuck, for your PMF, but if you'll send me something else about that, I'll try to answer that for you. Yes, if you are not seeing, if you need to change the provider, you do have the ability to change the provider as well. So if they're being seen by someone other than who was expected, you do have the ability to do that also. Okay, so if a task had been sent to a nurse, I'm just going to go in and open up, let's see. I'm just going to open up. So if I were a nurse and a message had been sent to me, like maybe the doctor sent me something about x-ray and said, call the patient, that type of thing, where the nurse could go in and add her note of what she had done on that particular patient. And so then I could go in and I can have quick text here as well. So I could say, what did I tell the patient? And I could have called the patient, spoke with and I could put my notations in there and save that information. And then I could mark it as complete so that I have finished that task and now it comes off of my list. So for the nursing worksheet, she has that way of doing it. You also, over on the left-hand side, if I just want to work off task and go through one by one individually, I can open up a window that is just showing the different tasks that I have as well. So you have some different options there. Okay, guys, time-wise, I know we are at our stopping point on the clinical here. If there's any other questions, I'll review those here, but let's take about a 5-minute break. So we'll be a couple of minutes late getting started back. So about 9:03 is when we'll get started on the front desk section. So if everybody wants to take a break, change staff, do whatever you need to then, and then we'll be ready to start back in just a few minutes.